Let's talk about navigating common challenges with getting referrals from doctors. So, you would love to be attracting more new patients as a holistic health practitioner through provider referrals. It's so great to get doctor referrals because when someone's referred by a doctor, they're more likely to start care, stick with it, and also follow your advice. And you don't need to be constantly marketing your practice once you start getting this stream of doctor referrals happening, because they could be referring people to you even 3 months from now or a year from now. So let's talk about common challenges with navigating getting referrals from medical doctors. So, hi, I'm Shanya, and your 6 and 7 figure practice makeover mentor at Introverted Visionary, where we help holistic health practitioners grow their practices to be fulfilling 6 and 7 figure practices the introverted way. One thing I often hear is this feeling of imposter syndrome, like not feeling up to par, feeling intimidated or getting nervous, not feeling like they would take you seriously, feel like they look down on you as if you're not as smart as them. And I will say that I have encountered that in my own career as a pharmacist working in the conventional healthcare system and working around medical doctors in different settings, hospital, outpatient, FDA, and at Merck, like having seen the insides of FDA and at Merck. I will say that unfortunately, I have encountered medical doctors who act like they know everything and then carry this air and this sense of pride. So I totally get it from that perspective of them having gone through a lot of training and residency and done a lot of time to get to where they're at. And so I think some medical doctors are that way because of how long it took them. And so in any case, that is going to happen. And so I think over the years, what I've noticed is this in terms of that feeling of where you don't like it when people look down on you because you know you have so much to offer and they are just in their own little world, which is why they might be acting that way. And so, what I will say is maybe those aren't the right kinds of doctors to be getting referrals from. There are plenty of medical doctors and other kinds of conventional medical practitioners and other kinds of holistic health practitioners would be totally happy to refer if they knew about you and how you could help them. There are nurse practitioners, nurses, PAs, PTs, there are other kinds of holistic health practitioners. And so it doesn't have to be like the doctor who looks down, who you feel like they look down on you, right? Because there's no reason to have to push uphill to that extent. I mean, it is helpful to be educating providers so they become more and more aware, because sometimes their air of pride comes from their world of knowledge and understanding of how things work. And so when you're able to educate them differently, then they might actually open up to it slowly more and more, right? So but in the meantime, if you would love to be getting referrals from medical doctors sooner rather than later, you don't need to be reaching out to those doctors who are just already like not even going to be interested. This imposter syndrome and that kind of a thing. I think one thing that's really important is to come from a place of being their equal. If you show up from this place of being concerned that they may not take you seriously or thinking that they won't refer because they see you as competition, or maybe you didn't have a good experience before and then just thinking that it'll be like that again. Like if you come into the conversation with that in mind and that experience in mind, then chances are you might show up in such a way that the doctors will sense that. And so part of it is really showing up as their equal, showing up as somebody who knows what they're talking about. And then it's not like you are asking them for something. It's like you are here to help them, right? Like energetically shift how you show up in the conversation, shift how you're showing up in what you say to them so that they see you as an equal. So then the question becomes, how do you do that? And then what to actually say so that they will see you as their equal. This is something we help our clients with in our system, where we help our clients with getting more doctor referrals, because part of it is that having just an idea of wanting to have a good conversation with a doctor isn't enough. Like you need to be prepared with how best to approach them, what kind of impression you're making on them, what to say, and what to also bring that could support getting referrals. So, and then it's also helpful to have a system in place for ongoing referrals too. So those are some of the things that we help our clients with through our doctor referral success system. And so let's see here. Something else that one of you wrote in is that I know how busy they are. So I feel this pressure to somehow make it worth their time, but not sure how to do that effectively. And, so part of it is how to talk about your approach and modality in a way that an MD or a conventional medical practitioner would understand. And one way to speed this up in terms of getting referrals from doctors is essentially by educating them on a topic that would be interesting and helpful to them. What would be an angle of a topic that would be helpful for them? And then essentially come up with what I call a signature talk that you can give to those providers, whether it's in a one-on-one setting, in a clinic setting, or in a larger setting. The reason for this is that because many times doctors aren't referring yet because they don't know about you and how you could really help their patients, like the scope of what you could really help their patients with. So that's why even if you were to have a good conversation with a doctor, they may not be referring because they aren't at that point where they feel comfortable giving you referrals. So one way to speed that up is by essentially educating them on one topic that would be interesting and helpful. For example, one of our clients spoke in a clinic setting, and we helped her with getting that signature talk in place with what to say, what to bring, and then she ended up getting referrals from that one opportunity. And then we've had clients who've done that too, and then they've gotten referrals after the fact as well. Right? When you do it well, you could actually get referrals even the first time you meet them, and then more opportunities will come from after that. And so it's all about having a system. It's all about having an approach that works and also feels good for you energetically too. In terms of how to talk about your modality, I can help you with that. So there's a good balance of what to share so that it doesn't lose them. And then what to share that would also help them feel comfortable from a scientific standpoint as well. And then knowing what to say that would make them want to refer to you is important too. So because it's one thing for them to know about you, it's another for them to actually send referrals to you. So that is going to be really important. Another thing I've heard from some of you is that they don't seem to care about my services when I tell them that I don't accept insurance. And so part of it is in how you frame that. Like if they ask you, oh, do you accept insurance? And you're like, no, I don't accept insurance. Well, then they feel like, oh, well, you can't provide, just hear overall like, no, right? So it's about how can you frame that in such a way that they're comfortable with it. Also, you can be getting referrals from providers who have concierge-based practices or have cash-based practices already too. So their patients are used to paying cash. But in terms of what if you only accept insurance, right? So it's a matter of how you frame it to the provider. For example, you could say that it is up to us to let our patients know what is available to them, and then they can make that decision. Right. And you could share a story about it with them. In fact, you could share this story if you don't have your own story about it, where we had a client of ours who has a cash-based practice, and she was going to move an hour away from her existing location. And she told a patient of hers who was on Medicaid, she said, I'm going to be moving and I'm going to give you a referral to someone who's closer to you. And guess what this patient said? She said, no, I save up my money every month to come see you. And it hit her. It made such an impression on her that it's like, wow, on some level, we can't judge people for what they can or can't afford. If it's important to them, then they will come up with it. But who are we to judge people? Who are we to judge that, oh, this person can afford this much to come see me, or this person can't afford it, so I'm not going to tell them about this thing being available, right? Like that's not really up to us to judge. You could tell the story to a provider who says that to you about, well, you don't accept insurance. My patients all expect to only have everything covered by insurance. So you could tell them the story, right? It's like it's up to us as providers to share with people their options, and then they could decide what to do about their care. And then share the story that I just shared with you. So part of it is about how you frame that. And then part of it is about who best to be getting referrals from, who best to reach out to be getting referrals from. So, these are things that we help our clients with through our doctor referral success system. Another thing that I've heard is this fear of rejection and of being too pushy. So I think that one thing to keep in mind is that there will be some providers who are a good match for you in terms of referring people to you. And then there will be some providers who aren't necessarily a good match. And it doesn't mean anything about you as a person or as a provider or your competency with clinical skills or anything, or about you as a person. Some people may just not be the right kind of match for you. And so instead of taking it personally, like, oh, I'm not hearing back, and then feeling concerned that it's about you, right? Like something's wrong with you, or that this sucks that they're not responding. Instead of it being about that, just remember that people are busy. And just remember that doctors are busy. And it may not be that they aren't interested, but at the same time, you can put things in place that will help them be more like that. You can actually put things in place and you can actually do things that will help with them actually responding to you. And that's why it's really helpful to have an approach that works well so that you're not constantly trying to do things and then it doesn't work, because that could feel defeating. So keeping that in mind. And then as far as the pushy part of it, we can never control what other people think about us. We can only control how we can do our best in something, and also share what we really believe will help someone. And if you could come from that place energetically, then, I was thinking about this one day. It's like, is there a pushy-o-meter out there? It's like this pushy-o-meter will be like, oh, no, you're pushy. Oh, no, you're not pushy. Oh, wait, you are pushy, right? Like there's no pushy-o-meter standard out there. So then who is the judge of that? There will be a spectrum of some people who think you're pushy, some people who don't think you're pushy. And then, so there's nothing we could have control over with that at all. It's just a matter of how we feel about ourselves. And if we can be in alignment and integrity with ourselves, that we come from a place of helping people, then even if someone does feel like we're being pushy, that's on them, it's not on us. So another thing I've heard from you is that medical providers are difficult to contact and get a hold of. So you're not alone with that, because their front desk is there to screen you out. Those gatekeepers are there to screen you out. So what if you could actually go around that? So when we work with our clients, we help them go around the gatekeepers instead of like going to the gatekeepers, right? So what are some ways around that? One way around it is to actually be educating the providers in a different kind of a setting. So where, for example, some of our clients have educated providers, a room full of providers at a time, whether it's in more of a conference setting or at a workshop type of a setting. And so then you could be seen by other providers as someone who is a go-to practitioner when you educate in that kind of a way. Now, if you feel like, oh, I don't know, I'm not ready to do something like that, don't worry. You could still be reaching out to providers and going around the gatekeepers. For example, when we work with our clients, we actually give them a script that you can copy and paste and use within LinkedIn. In fact, one of our clients was getting good results with reaching out to providers via LinkedIn and then getting opportunities for Zoom meetings that way. So we actually asked him, we're like, hey, could we share this with our clients? And he said, oh, sure. So that's now a part of our doctor referral success system. So things like that can help shortcut the process as well. And then if you are approaching a provider with something that is helpful and educational and that could be beneficial clinically to them, for example, educating them on an angle of a topic that would be helpful, then it would be something that they would be more interested in than if you were just like, hi, I'm here, I can help your patients, just like every other provider in the area who can help you with your patients, right? So if you could educate them, if you can approach them with that angle of educating them on a topic, that's something that our clients have had good success with. Whether you do that in a one-on-one setting, whether you do it where you educate the whole clinic at once, right? So essentially just coming up with that one signature talk that you can use in a setting where you might have 10 minutes with a provider, where you might have half an hour, or you might even have longer in front of a larger audience. So it could be adapted to different situations and also depending on your comfort level. So then that way you start getting traction and you're starting to get referrals from doctors, because it's more fun that way when you are actually doing things and then it actually is fruitful. So it's one of the few approaches that when you get in place, you don't have to be constantly marketing all the time. Most approaches to attract new patients into the practice require you to be constantly marketing all the time. This is one of the few approaches that you don't really need a whole ton of people referring. You just need a handful of people who are your biggest champions. So then I would say that, most practitioners just look at it as like, oh, this would be nice to do, and then never get around to it. Or they actually try it and then it's like, oh, this isn't working for me, so I guess this doesn't work. But that's because you haven't had a system before. And so for example, when you come into working with us we have two ways to work with us on this, whether it is in our consistent patients makeover mentorship for introverts or our 6-figure speaking makeover mentorship for introverts. So there are two paths you can go to be attracting referrals from doctors. One is without speaking, but the other is with speaking. And in fact, it could speed up getting referrals from doctors in the second avenue. But there are two ways of working with us on this. And so when you have a system in place that can help accelerate your progress with getting doctor referrals, and that is actually working, and you start seeing doctors referring, this could be something that happens even 6 months from now or a year from now without you having to be constantly marketing. So then I'm excited for those of you who are joining us in this coming up very soon. So go ahead and book a free call. Go to introvertedvisionary.com and book a free call with us to see how we can help you with getting this in place in your practice. So that way you have a constant stream of new patients into your practice who are ready and who would love to just start care and who are more likely to stick with it too. And getting this avenue in place, you don't need that many providers. You just need a handful of people who are your biggest champions. And then when you hit a tipping point, you will see a snowball effect, which is really amazing, which is really awesome. And so go ahead and go to introvertedvisionary.com and book a free call with us. And I can't wait to help you accelerate growth to 6 and 7 figures the introverted way through getting doctor referrals.